Heart disease doesn't discriminate. It affects men and women of all ages, races, and backgrounds. That's why it's important for everyone to understand the risk factors for myocardial infarction, the leading cause of death in the United States. In this video, we'll be discussing the different types of heart attacks, the symptoms to look out for, and the actions you should take in the event of an emergency. We'll also be sharing tips for maintaining a healthy heart, including dietary changes and exercise routines. Whether you've already experienced a heart attack or you're looking to prevent one from happening in the future, this video is for you. Let's get started. Myocardial infarction, MI, is a serious condition that occurs when blood flow to the heart muscle is blocked, resulting in the death of heart muscle cells. Also known as a heart attack, MI is one of the leading causes of death worldwide. According to the World Health Organization, an estimated 17.9 million people died from cardiovascular diseases in 2016, accounting for 31% of all global deaths. Causes of myocardial infarction. The primary cause of myocardial infarction is the buildup of fatty deposits or plaques in the arteries that supply blood to the heart muscle. These deposits can narrow the arteries and reduce blood flow, which can result in chest pain or angina. If the plaque ruptures or a blood clot forms on the plaque, it can completely block blood flow to the heart muscle, causing a heart attack. There are several risk factors that can increase the likelihood of developing myocardial infarction. Let's take a closer look at each of these risk factors in more detail. Number 1. High blood pressure. High blood pressure, or hypertension, is a condition in which the force of blood against the walls of the arteries is too high. Over time, this can damage the blood vessels and increase the risk of developing heart disease, including myocardial infarction. Blood pressure is considered high if it is consistently above 130/80ths of a millimeter Hg. Number 2. High cholesterol. Cholesterol is a type of fat that is essential for many bodily functions, but too much cholesterol in the blood can increase the risk of developing heart disease. High levels of LDL cholesterol, the bad cholesterol, can cause the buildup of plaque in the arteries, which can increase the risk of developing myocardial infarction. Number 3. Diabetes. Diabetes is a condition in which the body is unable to properly regulate blood sugar levels. Over time, high blood sugar levels can damage the blood vessels and increase the risk of developing heart disease, including myocardial infarction. People with diabetes are also more likely to have other risk factors for heart disease, such as high blood pressure and high cholesterol. Number 4. Smoking. Smoking is a major risk factor for heart disease, including myocardial infarction. The chemicals in cigarette smoke can damage the blood vessels and increase the risk of developing atherosclerosis, the buildup of plaque in the arteries. Smoking also increases the risk of blood clots, which can cause heart attacks. Number 5. Obesity. Being overweight or obese can increase the risk of developing heart disease, including myocardial infarction. Excess weight can lead to high blood pressure, high cholesterol, and diabetes, all of which can increase the risk of heart disease. Number 6. Lack of physical activity. Physical inactivity can increase the risk of developing heart disease, including myocardial infarction. Regular exercise can help improve heart health, lower blood pressure, and reduce the risk of developing atherosclerosis. Number 7. Family history of heart disease. If you have a family history of heart disease, including myocardial infarction, your risk of developing the condition may be higher. This is because certain genetic factors can increase the likelihood of developing heart disease. Number 8. Age. The risk of developing heart disease, including myocardial infarction, increases as you get older. This is because the arteries can become narrower and less flexible over time, which can increase the risk of developing atherosclerosis. Number 9. Gender. Men are more likely to develop myocardial infarction than women. However, after menopause, women's risk of developing heart disease increases. Number 10. Stress. Chronic stress can increase the risk of developing heart disease, including myocardial infarction. This is because stress can increase blood pressure and heart rate, which can put extra strain on the heart. Number 11. Drug abuse. Using certain drugs, such as cocaine, can increase the risk of developing myocardial infarction. These drugs can cause the arteries to narrow and increase the risk of blood clots. Number 12. Alcohol abuse. Drinking too much alcohol can increase the risk of developing heart disease, including myocardial infarction. Excessive alcohol consumption can raise blood pressure, increase cholesterol levels, and lead to obesity, all of which can increase the risk of heart disease. Symptoms of myocardial infarction. The symptoms of myocardial infarction can vary from person to person. Some people may experience mild symptoms, while others may experience severe symptoms. The most common symptoms of MI include chest pain or discomfort, shortness of breath, nausea or vomiting, sweating, lightheadedness or dizziness, pain or discomfort in one or both arms, back, neck, jaw, or stomach. It's important to note that not everyone who has a heart attack experiences chest pain. Women, for example, are more likely to experience shortness of breath, nausea, or vomiting than chest pain. Treatment of myocardial infarction. If you or someone you know is experiencing symptoms of myocardial infarction, it's important to seek medical attention right away. Treatment for MI usually involves a combination of medications, medical procedures, and lifestyle changes. Medications. There are several medications that can help treat myocardial infarction. These include aspirin, which can help prevent blood clots, and nitroglycerin, which can help widen the blood vessels and reduce chest pain. Other medications that may be used include beta blockers, ACE inhibitors, and statins. Medical procedures. There are several medical procedures that can help treat myocardial infarction. These include angioplasty. This procedure involves using a catheter with a small balloon on the end to widen the blocked artery. A stent may also be placed in the artery to help keep it open. Coronary artery bypass surgery. This procedure involves taking a blood vessel from another part of the body and using it to bypass the blocked artery. Thrombolytic therapy. This involves using medications to dissolve the blood clot that is causing the heart attack. Prevention of myocardial infarction. Prevention is always better than cure. There are several things you can do to help reduce your risk of developing myocardial infarction. These include quitting smoking. Smoking is a major risk factor for heart disease. Quitting smoking can help reduce your risk of developing myocardial infarction. Eating a heart-healthy diet. Eating a diet that is low in saturated fat, trans fat, and cholesterol can help reduce your risk of developing heart disease. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. Exercising regularly. Regular exercise can help improve your heart health and reduce your risk of developing heart disease. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, most days of the week. Maintaining a healthy weight. Being overweight or obese can increase your risk of developing heart disease. Maintaining a healthy weight through diet and exercise can help reduce your risk. Managing stress. Stress can increase your risk of developing heart disease. Finding healthy ways to manage stress, such as exercise, meditation, or talking to a therapist, can help reduce your risk. Limiting alcohol and drug use. Alcohol and drug abuse can increase your risk of developing heart disease. Limiting your intake of alcohol and avoiding drug use can help reduce your risk. Myocardial infarction is a serious condition that can have life-threatening consequences. Understanding the causes, symptoms, treatment, and prevention of MI is crucial for maintaining good heart health. If you or someone you know is experiencing symptoms of myocardial infarction, seek medical attention right away. Making healthy lifestyle choices, such as quitting smoking, eating a heart-healthy diet, exercising regularly, maintaining a healthy weight, managing stress, and limiting alcohol and drug use, can help reduce your risk of developing myocardial infarction and other types of heart disease. Thanks for tuning in and learning about myocardial infarction with us today. We hope you found this video informative and helpful in understanding how to protect your heart health. If you found this video helpful, be sure to like and subscribe to our channel for more informative content on health and wellness. Together, we can work towards a healthier future. Take care.